want to loop back to is
Yes.
your battle with Alberta Health. Tell me a little bit more. You're an oncologist and a radiologist, but you were involved in a very successful oncology clinic with stage 4 cancer patients who were doing very well under your care. And explain to the listeners what happened.
Yes, I came to Edmonton, Alberta to work at the Cross Cancer Institute, which is, a big cancer center here in Alberta. And the reason I came here was because they had state-of-the-art cancer diagnosis with PET-CT. So we had PET-CT available, which is one of the top technologies to diagnose the vast majority of cancers. And so I became the lead PET-CT radiologist for Alberta. I was reading over 1,000 PET-CTs every year. So I would diagnose about 1,000 cancer patients a year, and the PET-CT was something that the oncologists relied heavily on, and the surgeons. I mean, the surgeons would prepare their surgery based on my reports, telling them exactly where the cancer is located, how it's spreading, where it's spreading, and so on. And so we had cutting-edge diagnostics, but we also had cutting-edge therapeutics, cancer treatments, and the class of cancer treatments that I became involved in is called medical isotopes. Sometimes it's called targeted radionuclide therapy, radioligand therapy, and it's a brand new branch of cancer treatments that's highly successful and highly promising. And the reason it's successful, so successful and promising, is because what we do is we take a radioactive atom, like lutetium, which is a beta particle emitter, and we attach it to a molecule that specifically targets a unique receptor that is located on a tumor cell, but it's not located on normal cells. So, and then we inject it into the patients, and then it travels throughout the body. So it reaches all the cancer cells in the body. And then it attaches to the tumor cell and then starts releasing these beta particles. And these beta particles are very interesting. What they do is they destroy the DNA of the rapidly replicating cancer cell, but they don't travel very far. So they're really limited to maybe a cell and an adjacent few cells. So what you end up is you end up eradicating the tumor with the radiation, but then the radiation dies and decays within hours, and it doesn't reach the normal tissues. Or if it reaches the normal tissue, it's very, very minimal and minor. So what you end up with is you end up with targeted radiation therapy cancer treatment, where you end up killing the tumor cells without affecting the normal cells of the patient. And this is what makes it completely different from chemotherapy. Any chemotherapy that's on the market is still damaging your bone marrow cells, your blood cells, your blood counts. And
it doesn't discriminate, whereas
exactly.
This is precision.
Exactly. It's very, very precise. It's more precise than anything on the market today. For example, you can compare it to if you compare it to external beam radiation therapy, which is being used regularly, with an external beam, again, you have a beam that's being directed towards the tumor cell, but you have to go through normal tissue to get to the tumor. So you're damaging healthy tissue. So with external beam radiation therapy, for example, for breast cancer, with women who have their breast cancer tumor irradiated, they end up with radiation burns on their skin. They end up with scarring in their lungs as a result of the treatment. They end up with lymphedema. They end up with lung scarring. Whereas with this therapy, you end up with none of that. So it's very precise, targeted cancer treatment therapy. It was developed in Europe. It's been used in Europe since 2010. Actually, it was used even earlier than that. But what happened was that the FDA refused to approve it because it would cut into the profit that was being made by pharmaceutical companies that are selling chemotherapy. And so the FDA has sat on these treatments for almost 20 years, and only a couple of years ago, they approved the very first one. Now, we were lucky because we had created a trial approved by Health Canada, and got it approved. And so we were importing these cancer treatments from the Netherlands. and we started treating our cancer patients. I got this program up and running, and we managed to get about 200 patients recruited into the trial, and we had a response rate of 85%. So with end-stage cancer patients, and these were neuroendocrine cancer patients because we could target their tumor, we had a response rate of 85%. We were saving 85% of them, which meant that their tumor was rendered completely inactive so that the tumor couldn't replicate, or we managed to eradicate the tumor completely.
And these were
So
stage 4 cancer patients.
these were stage 4 cancer patients who had failed every other treatment. So they had failed surgeries, they had failed chemo, they had failed other drugs. And this was really their absolute last treatment option. And we were saving 85% of these patients. And so our program exploded. It was the largest cancer treatment program of its kind in North America. And I've had, Stanford University come to me and say, we want you to replicate this program at Stanford. We want you to replicate this at Johns Hopkins, at NYU, Mount Sinai in New York. All these big cancer centers in the States wanted. I even had them trying to send me patients. And I said, look, I can't take patients from the US or Australia because of Health Canada regulations. I can only treat Canadian patients. So I had patients who were referred to me from all over Canada. Mm-hmm. Now, we ran this program for 2 years. And then what happened was I didn't realize that this was going to happen, but the Alberta Health Services executives conspired to sabotage our program and destroy it and eliminate it completely so that Alberta cancer patients and really cancer patients throughout Canada would not have access to these treatments. And what they did was my director, the HS director of my department, spent 6 months going around the department asking my staff to see if anyone would file a complaint about me, really about anything. For one nurse, they offered her a promotion to AHS manager if she would file a complaint against me. Other staff, they offered promotions as well. And so they spent 6 months doing this behind my back. Some of my staff warned me that this was happening. And so I had some idea. I just didn't know. I didn't want to believe it. I didn't want to believe that they would do such a thing to try to destroy the cancer program that was so successful. And sure enough, they did it. They had someone file a fraudulent complaint, and then they organized really a security team. The first they came to my office, right after Christmas. I come back from a Christmas holidays. They come to my office. They'd spend all of Christmas preparing this. And they said, we're going to put you on unpaid administrative leave because someone complained against you, but we're going to keep paying you your salary, and, there'll be an investigation, and I'm sure you can come back after, and so on. So I said, okay, fine. And I said, okay, no problem. I'll go on the, paid administrative leave. And so I said, fine. And I decided to leave my workplace. And what I didn't realize was there was a security team in the adjacent conference room where they were going to remove me by force if I refused. And I obtained this from legal documents afterwards where they had discussions. Well, what if he refuses to leave? What are we going to do with him? Well, we're going to drag him out and we're going to cite occupational hazard. They were going to cite some nonsense to drag me out by force if I didn't leave willingly. So I left. And what they did was they filed fraudulent complaints against me at AHS and the college. So the college participated in this. And they dragged me out through, these complaint investigations for 10 months. And during that 10 months, I had lawyers from my medical malpractice who were saying, this is nonsense. This is made up. Dr. Makis's patients need him. His patients, they don't have any other doctor. I was the main doctor in that program. There was another doctor close to retirement who was seeing maybe 10% of the patients, but he couldn't handle the entire workload. And he was, in his 60s and, halfway retired. And so, I said, my patients need me. You need to wrap this up, dismiss this complaint, and bring me back. And the AHS lawyers kept saying, no, we can't, we won't. And what they did was they kept paying me my salary. So they paid me $60,000 every month. And they said, if you try to go back to the Cross Cancer Institute and try to treat your patients, we're going to have you removed by security. We're going to go after your hospital privileges. We're going to suspend your hospital privileges, and we're going to go after your medical license. And so then I realized that the reason why they kept stalling and dragging everything out was one of my AHS contracts was going to end in 10 months after they removed me. So they were going to pay me out to the end of my contract, and then they were just going to kick me out. And they were going to release me and my license and let me go at that point. But first they had to run out my contract. Then I receive a letter from AHS saying, we're not renewing your contract because we don't need you. And now I had patients who started dying because they were being denied cancer treatments. And they said, we don't need you. We're not renewing your contract. So this was happening for 10 months. And when I realized that they were going to destroy my cancer program and let my cancer patients die, I filed a lawsuit against Alberta Health Services and for breach of contract and really malfeasance in public office. And very shortly after that, they released my license initially because they thought I was going to move on. And then the moment I filed the lawsuit, a few months later, they came after my medical license again. And so, once my lawsuit was going, first they tried to pay me off. They tried to bribe me. So about 6 months after my lawsuit was filed, they came to me and they came to me with a settlement offer. And they said, look, we need you to stay silent about this. I was still communicating with some of my physician colleagues and to see what was going on, what's going on with my patients, what's going on, with my radiology practice. And of course, my colleagues were telling me it's chaos down here. Many of us are trying to pick up the slack. We're trying to cover your radiology, your PET-CT readings, but we're struggling with that. And with my patients as well, they were trying to find a student who might cover, the program temporarily. And of course, the doctor who was near retirement was struggling, trying to see everybody and trying to keep, the program afloat for a while. But, AHS just didn't give a damn. And so, so they wanted to bribe me and get rid of me so that this would all go away. And they came to me and they said, they gave me an offer in writing. This settlement offer is in the public domain. It's available in the Edmonton courthouse under docket QB 1603-18935. This is a legal document that's in the public domain. They offered me $400,000 in exchange for my silence. They said, that basically I had to sign non-disclosure agreements. I had to give up the rights to all of my Alberta Health Services contracts. And I had to promise I would never speak to my colleagues, my physician colleagues or nursing colleagues in my cancer program again. And the implication was that basically I had to leave Alberta. And I was given 1 week to sign this settlement offer of $400,000. And they even said, look, we'll even sweeten the deal. We'll find a way to make it tax-free. So it'll be like I'm getting double, right? And their reasoning was that they were basically paying me like an extra bonus, for those 10 months that I was dragged out of my office illegally and prevented from treating my patients. So it was kind of like they were going to double my salary and pay me off in exchange for my silence. And I said no. And that seemed to have shocked the executives at Alberta Health Services. Certainly the Lawyers Act really shocked. They thought that for sure I would take the deal and move on with my life. And that's what I was being pressured to do. I realized that them giving me 1 week to sign it was a pressure tactic. Normally they're supposed to give you, I think, according to the Alberta rules of court, you're supposed to get at least a month or two when there's any kind of settlement offer. So they were violating the rules, the Alberta rules of court already. And I refused. I said no. And really very shortly thereafter, the College of Physicians and Surgeons of Alberta created another complaint against me. And it came out of the blue. And apparently the complaint was made by someone who worked in our cancer program as a clerk, as a secretary. But she had a relationship with one of the AHS executives who was a defendant in my lawsuit.
Mm.
They had an intimate relationship. He would actually take her to conferences. They would stay at those conferences together. He would wine and dine her, and he would really use cancer research money to pay for trips, to take her on trips all over the world, to go on medical conferences with him. So I was at one of these conferences and I saw them there, and I just said hi, and that's it. And what happened was she had apparently called the college and said that I threatened her at this conference, that I had like threatened her with something, I don't know, physical harm or whatever. And so the college, Dr. Michael Cafaro, who we talked about earlier, what he did was he opened a college complaint against me himself. He said the college is opening. Now, she didn't put anything in writing. She apparently just made a phone call directly to Michael Cafaro, and I obtained legal documents afterwards, and apparently they were chatting on first name basis. She said, "Hey, Mike, this and this, what's happening?" And this is like one of the heads of the college, so I don't know how they knew each other from beforehand. But that's what I say is that the relationships between AHS executives and the college and so on, they all know each other. They're all friends. They all cover for each other. So Dr. Michael Cafaro opened a college complaint against me, dragged me through a completely fraudulent college hearing tribunal. The college had actually done an investigation, and the investigator said there's no evidence of these allegations. We just basically have to take her word on it, and that's it. There's no evidence.
Mhm.
In fact, I had contacted the organizers of the conference, and I said, "Look, put out a statement that there was no one complained about me at the conference. That I mean, there's security at these conferences. You can't just you can't threaten people or do what you want. There's security. There's people everywhere,
Mhm.
right? I mean, there's thousands of people that
So
attend."
what was the agenda? Why were they trying to shut down your clinic in Alberta as the oncology clinic?
Yeah.
What was the motive?
The motive was because, and I only found this out later on, some of it through legal documents and some of it through discussions I had with healthcare executives in British Columbia who actually knew exactly what was going on. I had many chats with the former president of the BC Cancer Agency, who was kind of involved in this situation himself. The reason they wanted to shut down the program in Alberta was because they wanted to rebuild the same program in British Columbia and Vancouver, in partnership with the UBC and BC Cancer and Triumph, which is actually a physics laboratory that produces medical isotopes for healthcare. And the Trudeau Liberal government was going to invest hundreds of millions of dollars into this program to create cancer clinics that were going to be the global leader in medical isotopes that would effectively start providing cancer treatments to Canadians through the public system, but would also have a private system of private clinics where foreign nationals from other countries like China and India, Japan, and so on could fly into Vancouver, get their cancer treatments for hundreds of thousands of dollars, and then go back, because you don't need to be hospitalized with these cancer treatments. You can do it as an outpatient. So imagine that you've got outpatient clinics. You can now start charging foreign nationals hundreds of thousands of dollars per treatment. I mean, we're talking billions of dollars in
In
in potential
revenue.
in revenue,
And your
in
clinic
profit.
wasn't making enough money then.
In profit, exactly. So my program wasn't making any money for anybody in Alberta. And I tell anyone who asks, the cancer treatments that we were giving cost $5,000-$10,000. We imported them directly from the Netherlands, where these medical isotopes were produced. We have them shipped by FedEx like the same day, because the isotopes decay very quickly. So what you have to do is you obtain them as they're produced from the Netherlands. They fly them in, and we use them immediately as soon as they come off the airplane. They're driven immediately to the Cross Cancer Institute, and we inject them to the patient immediately before the radiation itself dies off, because the radiation dies off very quickly. And Health Canada was paying for that. So really, all that Alberta Health Services was paying for these cancer treatments was my salary as a radiologist and my time, which half my time was spent in the cancer treatment clinics, and really the nursing and the technologists that they lent to the cancer treatment program from the radiology department. And this is what the Alberta Health Services executives complained about. They said, oh, you're costing us money, all of this is coming from the radiology budget, and we're not making any money on this. I was told. And of course, it's the public system, so you can't make money on this. I can't be charging cancer patients, for their treatments. Like I said, Health Canada covered the cost of the cancer treatment, and no one was making any money, and AHS executives were complaining. So I suspect what happened was the Alberta Health Services executives, who were appointed by Rachel Notley's government, and Rachel Notley had a very close relationship with the Trudeau Liberal government. They had conspired with individuals in healthcare in BC and with the Trudeau Liberal government to quietly shut down our cancer program in Alberta and basically leave our cancer patients to die. I mean, our cancer patients were left to die a certain death without these treatments. And because it was so controversial and so illegal, they had to do it quietly, and they had to basically smear me and destroy my career and my reputation and really remove me so that I was unable to treat my patients, so that they could then quietly rebuild that cancer program in BC, have a monopoly, because they needed a monopoly on these cancer treatments in order to call themselves a global leader. Because imagine if someone in China says, wait a minute, instead of paying $500,000 to get my cancer treated in Vancouver, BC, in one of these fancy clinics funded by the Trudeau Liberal government, why don't I just go to Makis in Alberta and get it treated for $10K or $5K or maybe for free? Right? Maybe I'll get somehow into the clinical trial and get it treated for free. You can't have that option available, right? And so there was a conspiracy between our provincial government and our healthcare leadership to shut down a successful cancer treatment program and leave hundreds of Alberta cancer patients to die, so that they could build their state-of-the-art cancer clinics in BC. And people can look this up. The Trudeau government, Justin Trudeau came personally to hand deliver the first check of these hundreds of millions of dollars. He brought a $10 million check with him in November 2018, and he did a photo op with leaders of UBC, BC Cancer, and Triumph, and there were several mayors that were present as well. And this was a photo op that he did, and he personally hand delivered a $10 million check to jumpstart this program that they had just successfully shut down in Alberta. There was an anonymous donation of $18 million that was given to BC Cancer at the same time, so that they could accelerate starting this program. It was the largest anonymous donation in BC Cancer history. $18 million from an anonymous donor. People can look this up. This is in the public domain. This was in the news. They were proud of this. They were bragging about this. And then shortly after, the Trudeau government allocated $300 million for this particular program. Now, you see, if the feds are investing $300 million of federal funds into this state-of-the-art cancer treatment in BC, that's a lot of money. You can imagine what the profit potential for them is if they have a parallel private system going with this as well. I was told by the former president of BC Cancer, with whom I had many discussions about this, and he was actually trying to get a lot of politicians on board. I was told that UBC, the University of British Columbia, had invested several $1 million of their own money to get this jump started. BC Cancer had invested millions of dollars, I think $5 million. And there were numerous former healthcare executives in British Columbia who were personally invested in this. There were politicians who put up their own money to get this going. And so they all want in on this new technology. They're calling it precision medicine. In fact, the My Cancer program that they destroyed, that they wanted to rebuild in BC, the private clinics, they wanted to call it the BC Center for Precision Medicine. I don't know if this name has been used yet or not. Right now, they're building gigantic buildings and complexes. One of them is called the Institute for Advanced Molecular Imaging, IAMI. Again, this is something people can look up. This is a huge complex. They actually bought a state-of-the-art cyclotron to produce the radioactive medical isotopes that are going to be used in this. And the Institute for Advanced Molecular Imaging is being funded mainly by the Trudeau government. So it's the Trudeau liberals that are heavily invested in pharmaceuticals in this. And of course, now we find out, when it comes to mRNA vaccine, that the Trudeau government, just made a deal to build a Moderna factory to produce mRNA vaccines in Quebec, in Montreal. Now they're talking about building another mRNA factory in Vancouver and BC. So really, when we see, Justin Trudeau come out and say, okay, everyone has to get their mRNA shots and everyone has to get, be up to date on their mRNA shots, or we're going to shut the country down again. I mean, he said this very recently, that everyone has to get vaccinated for COVID-19 and the flu, or he's going to shut down the country again. I think people have to realize that the Trudeau liberals are heavily financially invested in pharmaceuticals. Most of it is in British Columbia. Some of it may be in Montreal because, Trudeau has a riding in Quebec. But they're heavily invested in pharmaceuticals in BC. And the most profitable pharmaceuticals until the pandemic hit was going to be cancer treatment, precision cancer treatment, including molecular isotopes, medical isotopes like I was using. But now, of course, they're all going all in on mRNA vaccines and trying to invest themselves into the production of mRNA vaccines. So there's your motive right there. And, you can trace the money very clearly. You can even trace, the individual who's pictured in BC receiving the $10 million check from Justin Trudeau directly. This is a nuclear medicine doctor like myself. This is my counterpart at BC Cancer. He's the vice president of research at BC Cancer.
What is his name?
His name escapes me right now. It's sorry, I was just on a long train of thought, but I'll try to look it up and find it for you. He's the vice president of research at BC Cancer, nuclear medicine physician. I can't think of his name right now, but
and whatever happened to the Dutch company that you were working with? Is the Canadian government going to cut them out of the deal?
Oh, absolutely. Absolutely.
What is the name? What is the name of the Dutch company that you were working with?
Honestly, it's I don't recall their name right now either, but they were producing not just for us, they were producing for the rest of Europe as well. And what happened was one of the complexes that they're building in Vancouver, BC, this Institute for Advanced Molecular Imaging, it's this, $30+ million building that's on a, big city block. And they bought a state-of-the-art cyclotron, which is another machine that costs, $30 million. And of course, to staff it and everything, you're looking at over $100 million just for this one building alone. Is they want to produce these medical isotopes on site. They don't want to be importing it from Europe or relying on Europe. Really, the money is in producing these cancer treatments on site, so that you can basically just walk across the street. You produce the radioactive material that morning, you do the quality control on it, that takes an hour or two. And then you walk it across the street to your fancy new cancer clinics and you charge patients, $200,000, $300,000, $400,000, $500,000 per treatment. And, it might cost you, $500 or $1,000 to produce. And, you're charging patients $500,000. This is, we're talking obscene amounts of money involved. And really, when they came after, nobody cared about my cancer program. When I was treating cancer patients with a rare cancer, neuroendocrine cancer is quite rare. Neuroendocrine cancers, they can arise in the pancreas. So, for example, like Steve Jobs died of a neuroendocrine cancer of the pancreas. They can arise in the small bowel, large bowel. But this is a rare cancer. Out of cancers, we're talking a few patients out of 100,000 cancer patients, quite rare. So no one can make any money off it, right? That's why I had only several hundred cancer patients as opposed to thousands of cancer patients, because I was treating a particularly rare tumor type. However, just before they shut down my program, there was a major discovery made, that you could use this same technology to treat prostate cancer patients and breast cancer patients, and the receptor to deliver this radiation to prostate cancer had just been developed. So that's when they realized the money-making potential of this, and that's really when the wheels went into motion to say, wait a minute, Makis's few hundred neuroendocrine cancer patients can die. We don't care. Let those patients die. We have hundreds of thousands of prostate cancer patients that we can treat at 100,000 plus per treatment. And of course, you have to get several treatments. So we're looking at least $500,000, for a person to get their entire treatment. We're talking profit margins in the billions of dollars, right? And so
And
what happened was,
or do you think the plan is to offer this to Canadians, or is it really they're trying to run a Mayo Clinic, model where you import your patients?
I think what they're going to do is they're going to do both to stay under the radar. So in terms of the health regulations, you cannot run fully private clinics like this, like cancer clinics. And actually, I was asking the president of the BC Cancer how they were going to get around the legal aspects of this, and he said, "Oh, don't worry, we're going to cycle the money through multiple companies in Germany and so on, and by the time it gets back to them, it's basically money laundering." It was the money was going to be laundered through several entities so that it would completely bypass any kind of law that might be there to protect patients from having to pay. But they were going to offer this to initially to cancer patients in BC, and maybe make it available to a limited number of patients in the rest of the country. But the problem is that they don't have this up and running, and it's going to take many years to get this up and running. And in the meantime, they've left my cancer patients to die. They've left many other cancer patients throughout Canada to die who might have had access to my program. Now, Health Canada had limited our clinical trial to 400 patients, but I was informed that we could have easily expanded that to several thousand patients as our program grew, and they killed our program before we could get that expansion going. And
Absolutely, you hear this and it's so criminal at such a high level.
And I'll give you one more example. The company that developed the peptide to treat prostate cancer. This is called PRRT. And again, people can look it up. But the company that had developed it, I think the company was worth something like $16 million. And what happened was, as soon as this discovery was made, that this could treat prostate cancer, the company was bought out by Novartis, which is a huge pharmaceutical company. Novartis bought them out for $2 billion upfront, no questions asked. And of course, Novartis has deep relationships in Canada with healthcare executives in Canada, in British Columbia, and with the Trudeau government. So they bought this out. They bought the rights to produce this pharmaceutical. Of course, those rights will be lent to the BC Cancer and UBC to produce the pharmaceutical. With obviously they're going to give a cut to Novartis. But this involves a big pharmaceutical giant like Novartis is finally interested in this. So as I mentioned, in the past there was no money in this, and the FDA suppressed it for 20 years and wouldn't approve any of these treatments because it would cut into the profit of drug companies who are focused more on chemotherapy that was, in most cases, damaging people's healthy tissues and healthy cells. And sometimes you've got these chemotherapy regimens that only have a 10%, 20%, 25% response rate. And here we're sitting with 85% response rate. We can't get FDA approval. Our patients are treated as outpatients. Now, chemotherapy patients go through a very, very rigorous treatment. They have to be they have to go to these cancer centers. They often have to be monitored for their blood work. They lose their hair. They often have to be hospitalized because, they'll get infections when their blood counts are down, their bone marrow is suppressed. And here we are giving treatments where a patient can walk into an outpatient clinic, get their cancer treatments, and walk out, go about their day like nothing happened, right? Like none of my patients had to be hospitalized. Our blood counts almost never went down, right? And so finally, the pharmaceutical giants decided, okay, now it's time for us to make obscene amounts of money on these cancer treatments. Oh, look, there's Trudeau government going around shutting down Makis's cancer program in Alberta. Trudeau is obviously using public funds to build all of these facilities in Vancouver, which are going to be producing, pharmaceutical and radioactive products for their private clinics as well. That's all funded publicly by public funds. And this is what they do, is they build infrastructure with public funds that then they plan to use for private clinics. Right. And so here's Trudeau running around the country, handing out checks, committing $300 million to this project. And who cares if a few hundred cancer patients die in Alberta? We have a friend in Rachel Notley, who's going to make a phone call to the Alberta Health Services executives, Dr. Verna Yu and Dr. Francois Bélanger. They're going to have Makis dragged out with a security team. We're going to have lawyers, teams of lawyers. Lawyers, Alberta Health Services has spent more than $5 million in legal fees, trying to get me kicked out of the province, trying to make sure I can't practice medicine in Alberta. $5 million. Like, this is not even counting the patients who've died, the patients who've suffered, all the PET-CT scans that went unread. Now we have a record backlog of reading CT scans, MRI scans, because you have 3 radiologists trying to, take on my PET-CT workload because I was reading the most PET-CTs in the province. And so it's just
it's outrageous. And the families, you said that a good number of your patients have died.
I'd say almost all of them.
And now their families must be outraged. They were thriving under your care, and all of a sudden the treatment is withdrawn.
Yeah, and basically what happened was they were told, well, the treatment's no longer available. You're going to be given another oncologist. So there were other oncologists who, were in the program, but all they could offer was chemotherapy that had a success rate of 10%, 15%. They were basically left to die. And on top of that, not only were they left to die, but they were basically offered a chemotherapy regimen that neuroendocrine tumors don't even respond to. So they were probably given a horrific chemotherapy regimen. They probably had a very, very poor quality of life at the end of their life, and they were left to die. And unfortunately, the Alberta Health Services executives have never admitted to anybody what they've done. In fact, when I submitted documents to the Edmonton Police and to the RCMP, what they did was, when they filed a fraudulent court application to have me declared a vexatious litigant and have my lawsuits thrown out, they actually asked the court to order the Edmonton Police and RCMP to delete all documents relating to my case, because some of those documents were under legal privilege because they were obtained through discovery process in the lawsuit. So if a document is obtained during discovery, apparently I cannot give it to the Edmonton Police and I cannot give it to the RCMP, even if those documents show that my patients were effectively murdered by AHS executives. And so they had the guts to order their lawyers to pursue me in court, file a fraudulent court application to have me declared a vexatious litigant in order to have my lawsuits thrown out, and have the court order the Edmonton Police and RCMP to destroy the documents. And I think what happened was, the judge said that my lawsuits absolutely have to proceed. My lawsuits are legitimate. However, in the case of like the documents, because of like legal issues, that maybe the Edmonton Police and RCMP should go ahead and delete those records. And that's how they...
It sounds to me like a class action suit should be started on behalf of these families against Alberta Health Services.
Yeah.
You know, you've got hundreds of families who have lost a family member unnecessarily.
But the problem is that they've been covering it up. And like I said, the millions of dollars that Alberta Health Services has spent on lawyers trying to cover this up, they have teams of lawyers. Like, I've shown up in court. Now, I'm self-represented because I've spent $250,000 of my own money on lawyers.
Mhm.
And at some point, I just ran out of money. I said, okay, I can't continue funding, top lawyers in Alberta at $400 or $500 an hour. Like, I'm going to go bankrupt, right? So at some point, I had to let my lawyers go, and I became a self-represented litigant. So, you have these situations where I show up in court by myself, with my little, laptop bag of legal documents. And I look beside me and I see a team of 5, 6, 7, 8 corporate lawyers in suits, dressed head to toe, with thousands and thousands of documents. And they're there, they're threatening the judge, they're harassing the judge. I mean, these are nasty, nasty individuals. And these huge corporate teams that are paid by Alberta taxpayers. This is all paid by Alberta taxpayers, right? This is money that is being stolen from patient care, that is being redirected to AHS Legal, which is run by AHS executives. And AHS Legal hires the top lawyers in Alberta, the most expensive lawyers. And what they do is really, they go to court and they try to exploit every legal loophole possible to harass and really attack and damage someone like me, right? And that's what they've been doing in court for the past 4 years. So instead of my lawsuits continuing to proceed to trial, what they've done instead, at some point, they said, okay, we're not going to allow you to question under oath AHS executives. And instead, we're going to now start filing complaint after complaint in the court applications to either silence you on Twitter. So I had 4 applications filed against me to silence me on Twitter so that I could never speak about AHS or the college. And in fact, during these applications, the AHS lawyers asked the court to suspend my charter rights to freedom of expression. And the judge was just looking at them and he's like, are you guys serious? Like, he's like, yes, there's such and such precedent from 1955 that, we can suspend Makis's rights to freedom of expression, based on this case and that case. And he shouldn't be allowed to talk about our corruption and corruption about Alberta Health Services and the college publicly on Twitter. And the judge said, okay, then why are you not filing a defamation lawsuit against Dr. Makis if you claim that Dr. Makis is defaming you publicly on Twitter and other social media? And they just stood there in silence. So the judge basically laughed and said, okay, I'm going to review everything that you've submitted. And of course, they submitted thousands and thousands of pages. The AHS legal briefs were huge. And, they have to charge Alberta taxpayers for their time and services. And in the end, the judge threw everything out and said, no, you cannot, suspend Dr. Makis's charter rights to freedom of expression. You didn't make your case. And really, the judge didn't even want to go into the legalities of the charter rights to freedom of expression itself. He just said, look, you didn't make your case at all. I'm dismissing all of this. And so these are the kinds of court actions that I've been attacked with over and over and over. They filed 13 such court actions against me. They've tried to have me declared in contempt of court. They've tried to have me silenced repeatedly, and they've tried to get the lawsuits thrown out repeatedly as well. And when they failed to do it the first time, now they're trying to use legal loopholes in the Alberta rules of court. And they're trying to do a kind of a roundabout way to get my lawsuits thrown out. And so they're harassing judges nonstop to get court dates and to try to get my lawsuits thrown out.
It's outrageous. It is outrageous. And this is Canada. This is Alberta. I hope that you're able to sit down with Danielle Smith and suggest to her that she gets busy in Alberta and starts another clinic with you in providing this service to Canadians at the most affordable price.